Contraception, intrauterine contraceptive devices. First generation is Lippel's loop. First generation is Lippel's loop, foreign body action. Second generation act by causing aseptic inflammation, spermatotoxic action of copper, foreign body action. Copper 7, copper 380, Ag30, surface area of ceiling, copper to an device. This is only effective for 5 years. Paragard is effective up to 10 years. Third generation progesterone containing devices. Progestasert 38 milligram releases 65 micrograms per day. 11 devices. Mirena 52 milligram releasing 20 microgram per day. Also used for management of menorrhagia, endometriosis, endometrial hyperplasia. Mechanism of action of IUCD. Foreign body action, endometrium non-receptive, decrease ovulation. Important information. Progesterone is having another action. Act by thickening of cervical mucus. Main action. 11-nogestrel also makes cervical mucosa thick, but main action is making endometrium non-receptive. LNG also makes cervical mucosa thick, but main action is making endometrium non-receptive. Side effects of IUCD. Most common bleeding is increased by 3 times than pain. Perforation at the site of insertion. Important information. For first 3 months, for bleeding after IUCD, we give prophylactically non-steroidal anti-inflammatory drugs and tranexamic acid to some patients. Tranexamic acid is most commonly used in casualty for bleeding, to stop bleeding. Pregnancy with IUCD in situ management. If patient wants to abort, medical termination of pregnancy is done. If patient wants to continue, we try to remove IUCD. If thread is not visible, then explain that there are 50% chances of abortion. Important information. Overall chances of ectopic pregnancy slightly more patient having IUCD as compared to normal woman having pregnancy. Lost IUCD. First step, exploration in OPD with artery and forceps. If not found, then do ultrasound and locate device. Even then, if not found, we do radiography, X-ray. Kani rule out pregnancy before first hand, because X-ray is teratogenic to fetus and it can cause abnormalities, malformations. So no pregnant woman should be gone under X-ray. If X-ray is done, it should be done in AP view and also lateral view. In AP view, if it is inside the uterus, it will be seen inside the uterus. If it is not inside the uterus and if it is outside, we call it perforation. It may be out, it may be in the intramural area, it can be outside the uterus attached, or it can go near the ovaries or into the abdomen. In lateral view, if the uterine sound and copper device are in same plane, copper T is inside. Sterilization. Vasectomy. Failure rate is less than 0.1%. Non-scalpel vasectomy done by artery forceps under local anesthesia. Avoid intercourse without condoms. barriers for 3 months or till 30 ejaculations. Non-scalpel vasectomy, Artian forceps under local anesthesia done in OPD. Avoid intercourse without condoms. Barriers for 3 months or till 30 ejaculations. Appudu after 3 months semen analysis is done to see azoospermia. Reversibility is only 30 to 35% successful. దానిని వేసోవేసల్ రియనోస్టోమోసిస్ అంటాం. ట్యూబెక్టమీ, puerperal tubectomy within first 7 days, best done 2 to 3 days from delivery, done by open technique, mini laparotomy, 1.5 to 2 inches incision. Puerperal tubectomy అంటే which is done within first 7 to 10 days after the pregnancy, or best done 2 to 3 days ఫ్రమ్ ద డెలివరీ. అంటే అదే ప్రెగ్నెన్సీ డెలివరీ అయిన తర్వాత 70 days కానీ 2 to 3 days ఫ్రమ్ డెలివరీ. ఇట్ ఈస్ డన్ బై ఓపెన్ టెక్నిక్, మినీ ల్యాపరోటమీ, 1.5 to 2 inches ఇన్సిషన్ ఇస్తారు. ఇంటర్వల్ స్టెరిలైజేషన్ ఆఫ్టర్ 6 weeks, మోస్ట్లీ డన్ బై లాప్రోస్కోపీ. ఇంటర్వల్ స్టెరిలైజేషన్ లాప్రోస్కోపీ ఆఫ్టర్ 6. కాన్కరెంట్ స్టెరిలైజేషన్ దన్ అలాంగ్ విత్ అనదర్ సర్జరీ. ఇది వెరీ కామన్ నౌవేడేస్. కాన్కరెంట్ స్టెరిలైజేషన్ అంటే లోవర్ సెగ్మెంట్ సిజేరియన్ సెక్షన్ ప్లస్ ట్యూబల్ లైగేషన్ ఆర్ మెడికల్ టర్మినేషన్ ఆఫ్ ప్రెగ్నెన్సీ ప్లస్ ట్యూబల్ లైగేషన్. సైట్ ఆఫ్ లైగేషన్ ఈజ్ isthmus is the most common. Reanastomosis of tubectomy is reversibility. Isthmic reanastomosis up to 80% success, uniform curtains. Isthmoampullary reanastomosis 30% successful. Most common method for tubectomy, modified Pomeroy's method. Risk of spontaneous reanastomosis. ఇందులో ఏమవుతుందంటే the segment is tied and this segment is cut. This segment is cut, but because both the ends were tied together, the risk of spontaneous reanastomosis can be seen here. Tube is grabbed in mid portion using the Babcock clamp. Suture remains. Suture tied and cut. Segment of tube incised. The suture dissolves and the tubal ends retract. I retract అవ్వకపోతే reanastomosis అవుతుంది. Other methods, Parkland's technique. ఏం చేస్తారంటే we hold the clamps and we cut the isthmus some part and we leave the Irving surgery technique. We cut the tube and bury into the uterus and the other end buried into mucus. Failure rate is very less. ఇక్కడ కట్ చేసిన తర్వాత ఒక పార్ట్ యూటరస్లోకి పెడతాం, ఇంకొకటి మీసోసాల్పింగ్స్లోకి ట్రై చేస్తాం. సో the failure rate is very less. Kroner's fimbrectomy, which is not done nowadays. Madeliner's method, only crushing of tube done, no cutting, high failure rate, so not done. ఆ ట్యూబ్ని బాగా క్రష్ చేస్తారు, సో కట్టింగ్ ఏం జరగదు. హై ఫెయిల్యూర్ రేట్, ఎందుకంటే అది మళ్ళీ ఇట్ కెన్ హీల్. That is Madeliner's method. Assure ring, hysteroscopic procedure. Putting of nitinol, nickel plus titanium coil into tube, causes fibrosis of the interstitial part of the tube within 3 months. ఇది వెజైనాలోంచి లోపలికి వెళ్ళి సర్విక్స్ అండ్ యూటరస్లోకి ఎంటర్ అయ్యి విత్ ద ఇంటర్స్టిషియం పార్ట్లో కాయిల్ స్ప్రింగ్ లాంటి కాయిల్ ఉంటుంది, అది పెడతారు. సో ఇట్ కాజెస్ ఫైబ్రోసిస్ ఎట్ ద ఇంటెస్టిషన్. Hysterosalpingography is done after 3 months to confirm the fibrosis. ఇది ఎందుకు అంటే ఎంత ఫైబ్రోస్ అయిందో చూడడానికి, ఆర్ టు చెక్ ఇఫ్ ఇట్ హ్యాస్ ఫెయిల్డ్ ఆర్ ఇట్ కేమ్ అవుట్. అది కొంచెం లోపల ఎంబెడ్ అయి ఉంటుంది కాబట్టి అంత ఈజీగా రాదు. ఫెయిల్యూర్ రేట్స్ ఆఫ్ కాంట్రాసెప్టివ్స్. Failure rate of contraception drugs is calculated by Pearl Index. Total number of accidental pregnancies by total months of exposure into 1200 is the Pearl Index. The most common question asked also in SPM and OB-GYN together as integrated question. Please find the Pearl Index of so and so woman anesthesia. Rates of failures. Vasectomy 0.1%. ఏంటి ఇవన్నీ రేట్స్ ఆఫ్ ఫెయిల్యూర్స్. ట్యూబెక్టమీ 0.2%. ఇంట్రాయూటరైన్ కాంట్రాసెప్టివ్ డివైస్లో 0.5 to 6% is for copper device and 0.2% is for levonorgestrel. So it has low failure rate కాబట్టి levonorgestrel is most commonly used. Combined oral contraceptive pills are also used, but it has a failure rate of 0.6 to 0.7%, and which should be taken every day. So not every woman would prefer taking it daily due to stigma and so many other things. Progesterone only pill has 1 to 2% failure rate. Barrier methods, male 14 to 20%. All the male barrier method. Natural method is worst అంట. ఎందుకు అంటే so many other reasons. It can be due to prolactin and the lactating time for women where the periods doesn't come, which is much safer, but during that time also there is chances of ovulation. Also during the periods and non-fertile periods there is also a natural method, and for males it's the retraction of the penis before the ejaculation, but the chances are still there because the precum can also contain sperms. Implants like Norplant, Implanon have a failure rate of 0.05%. Progesterone implants, Norplant 6 stems, 36 milligrams each, 216 milligrams of levonorgestrel applied as subdermal implant over the మన బైసెప్స్కి దగ్గర ఎక్కడో పెడతారు. ఇట్స్ ఎఫెక్టివ్ టిల్ 5 years. బట్ ద న్యూ అప్గ్రేడ్ ఈజ్ నార్ప్లాంట్ 2 ఆర్ జాడెల్, which is 75 milligrams into 2 stems పెడతారు, which is total of 150 milligrams of levonorgestrel. This is also effective for 5 years. Etonorgestrel implants, synthetic or degradation product of desogestrel and extremely effective. Implanon 68 milligrams single stem effective till they are withdrawn in most countries. Nexplanon barium coated. ఇది ఎందుకు అంటే మెయిన్లీ బికాస్ barium is radio opaque. So this implant is so easy to locate and remove later on. COCBs, combined oral contraceptive pills, that is estrogen plus progesterone, inhibits follicle stimulating hormone and luteinizing hormone from pituitary, which suppresses ovary. As the ovary suppress, estrogen causes proliferation of uterus, progesterone causes secretion of endometrium. So women will have artificial periods. We do not ovulate and do not conceive. Mala D and Mala N are the medications of combined oral contraceptives, where estrogen 0.03 milligram 30 micrograms, progesterone 0.15 milligram 150 micrograms. Natural methods of contraceptions failures and failure 60/100 women here. Calendar rhythm safe period or fertile period method ఇందాక చెప్పుకున్నాం కదా. From 11th to 16th day high chance of contraception as on 14th day ovulation occurs. The 14th day అంటే from the period starting day 1 నుంచి 14th కాదు, it is always -14. So when your period starts, -14 days, that is the 14th day. So always count from that. So avoid sex in this period. So if the person has 32 days of menstrual cycle, 32 minus 14 gives you the fertile day. So if it is only 26 days, it's still 26 minus 14. Cervical mucus method. Watery mucus occurs during ovulation period. So the secretion increase causes wetness in vagina. Avoid intercourse in this period, known as Billings method. Withdrawal method. Basal body temperature increases during ovulation. Progesterone is a thermogenic hormone. టెంపరేచర్ చూసుకుంటూ ఉండొచ్చు, ఏమీ వద్దనుకున్న వాళ్ళు డైలీ. ఓవర్ టైమ్ దే కెన్ జస్ట్ మాస్టర్ వెన్ ఇట్ ఈస్ రిలీజింగ్ అండ్ దే నో ఇట్. Previous year questions. A woman with an IUCD came to OPD for removal, but the gynecologist could not remove the ICD as there was no thread visible to pull on. To locate the IUCD, an ultrasound was done. IUCD was seen besides the ovary. How would you remove this IUCD? Because it is seen beside the ovary, and has already penetrated లోపలికి వెళ్ళిపోయింది. సో laparoscopy. Hysteroscopy is done when the UCD is inside the uterus. అంటే మయోమెట్రియంలో అల్ట్రాసౌండ్ గైడ్ రిమూవల్ బై ఆన్ IUCD put when the just thread went inside and it is still inside between the endometrium somewhere. The oral contraceptive pill Malayan contains which of the following type of progesterone component? Malayan is freely available and it is provided by the government. Levonorgestrel. Malayan contains levonorgestrel, which is now very commonly used. Which of the following is not a mechanism of action for oral contraceptive pills? First, mechanism of action of oral contraceptive pills prevents ovulation, yes. Prevents implantation, yes. Thickens cervical mucus, yes. But it inhibits gonadotropin secretion. It increases అని ఇచ్చాడు కాబట్టి that's the wrong answer. COVID-19 and pregnancy. Problems expected and seen in COVID pregnancy. Cough, fever and shortness of breath are the common symptoms for all the patients. Severe symptoms like pneumonia and marked hypoxia అవి ఎక్కడ కనిపిస్తాయి అంటే immunocompromised and chronic conditions like diabetes, cancer, chronic drug conditions. Important, pregnant women are not necessarily more susceptible to COVID nor have worse prognosis than normal. So దీనికోసం స్పెషల్ గేమ్స్ కూడా అక్కర్లేదు. Vertical transmission. Fetus is unlikely exposed during pregnancy. Amniotic fluid, cord blood, neonatal throat swabs, breast milk, genital fluid samples from infected mothers have all been found negative. అన్నీ నెగిటివ్, ఎక్కడ కూడా పాజిటివ్ లేదు. ట్రాన్స్మిషన్ ఫ్రమ్ మదర్ టు బేబీ ఈజ్ మోస్ట్ లైక్లీ డ్యూ టు ప్రాక్సిమిటీ ఆఫ్ బేబీ టు మదర్ డ్యూరింగ్ నర్సింగ్ అండ్ కేరింగ్ rather than vertical transmission. So vertical transmission is absent and not found according to the data. Fetal effects. No data to suggest increased risk of miscarriage. No data to suggest teratogenicity unlikely to cause congenital defects. Antenatal management. Self-isolate for 14 days, common for everyone. Avoid going to work, public places. Stay at home in well-ventilated rooms. Separate from other members of household. Allow no visitors. దీనికి కోవిడ్ ప్రోటోకాల్ ఫాలో అవ్వాలి. హౌ ద ఎయిర్ మేనేజ్మెంట్ ఎవ్రీథింగ్ ఎలా వాష్ చేసుకోవాలి. ఇంట్రాపార్టమ్ మేనేజ్మెంట్. కంటిన్యూస్ electronic fetal monitoring is recommended as there are reports of intrapartum fetal compromise, which is also normally done చూసుకుంటూ ఉండాలి for normal pregnant women also. Mode of delivery. Not itself is an indication for lower segment cesarean section or operative delivery. To be done based on obstetric requirements or if severe respiratory distress demands urgent delivery. Delayed cord clamping is recommended as usual unless contraindicated for obstetric reasons. Postpartum management. Test neonate for COVID-19 okay but test చేయి ఉందో లేదో తెలుసుకుని. Separate isolation for mother and baby for 14 days. ఇప్పుడు బ్రెస్ట్ ఫీడింగ్ డస్ నాట్ ఇంక్రీజ్ రిస్క్ ఆఫ్ ట్రాన్స్మిషన్, కానీ ప్రాక్సిమిటీ విత్ మదర్ డ్యూరింగ్ డస్, అంటే బేబీ మదర్ దగ్గరలో వచ్చే ఛాన్స్. దేర్ ఫోర్ బేబీ మస్ట్ బీ కెప్ట్ సెపరేట్ ఫ్రమ్ మదర్. హౌఎవర్ మే బీ ఫెడ్ ఎక్స్ప్రెస్డ్ బ్రెస్ట్ మిల్క్, బాటిల్ ఫెడ్. సో అలా